buongiorno e a nome del ProMIS e delle colleghe del VP10 del Partenariato europeo THCS vi do il benvenuto a questo webinar che ha l'obiettivo di illustrare i contenuti, le funzionalità e anche le modalità di accesso alla piattaforma del Knowledge Hub del partenariato stesso. Questo webinar si terrà in parte in lingua italiana e in parte in lingua inglese e per voi che state seguendo in diretta l'evento c'è la possibilità di avere la traduzione simultanea. Quindi a questo proposito vi ricordo, qualora non l'aveste già fatto, di scaricare inquadrando questo QR code attraverso il vostro cellulare l'app che è completamente gratuita, inserire il codice relativo alla riunione odierna per avere la possibilità di seguire il webinar con la traduzione simultanea direttamente attraverso le vostre cuffiette auricolari. Ringrazio le due relatrici di oggi che sono la dottoressa Pavlikova del Scottish Government, che è il leader del VP10 di THCS, e la dottoressa Lisa Leonardini, che è la coordinatrice tecnica del ProMIS, a cui do immediatamente la parola per poter iniziare.
Grazie Giulia, ringrazio tutti i partecipanti, ma in particolare ringrazio Andrea per la collaborazione e anche l'opportunità di raccontarci direttamente un deliverable che di fatto nasce da un forte lavoro che sta portando avanti, insomma, la sua organizzazione. Attendo le slide, giusto Giulia? Grazie mille. Bene, io ruberò veramente pochissimi minuti perché poi il fulcro dell'attività è appunto la presentazione del Knowledge Hub. Bene, si può andare avanti, grazie. Allora, grazie. Allora, come diceva Giulia, oggi di fatto lo dedichiamo alla presentazione del Knowledge Hub che nasce nell'ambito del Partenariato THCS, ovvero un partenariato dal titolo completo Trasformazione di sistemi sanitari e di assistenza. Un partenariato che è coordinato dall'Italia e nello specifico dal Ministero della Salute e al quale il ProMIS di fatto è affiliato e il ProMIS contribuisce proprio alla gestione del management del partenariato, ma poi collabora in vari pacchetti di lavoro, così chiamati per i tecnici, ed in particolare anche ha collaborato nel supportare il governo scozzese nel portare avanti la costruzione di questo hub che dovrebbe in qualche modo essere al servizio di tutti i ricercatori. E ci crediamo fortemente, ci ha creduto anche tanto la Commissione europea nella costruzione di questo Knowledge Hub. Abbiamo voluto in qualche modo portarlo come esemplificazione, come pratica a livello nazionale nostro italiano, perché crediamo che il Knowledge Hub possa funzionare nel momento in cui è alimentato da tutti. Quindi è un knowledge hub che funziona a doppio canale. Sicuramente il partenariato dà i contenuti, ma sicuramente tutti i ricercatori in tutti gli Stati membri e oltre gli Stati membri possono contribuire portando le loro esperienze all'interno di questo knowledge hub. Quindi senza dilungarmi di più, vi ringrazio ancora per esservi collegati, lascerei la parola ad Andrea, che ringrazio ancora, e ascoltiamo, e quindi con la traduzione in italiano dalla voce di Andrea, com'è costruito, qual è l'obiettivo e come si può poi alimentare, utilizzare e sfruttare. Grazie.
Thank you very much, Lisa and Julia, for inviting me. I will just quickly share my screen. Can you see my screen, right?
Okay. Yes, perfectly, Andrea.
Brilliant. So, thank you very much again. So, as I was introduced, I am Andrea Pavlikova and I work for Scottish Government, and we lead this work package which is dedicated to the development of Knowledge Hub. But I would like to emphasize that this is a very collective work of the partners involved in the partnership. And also, as it was mentioned, we also have a great support from the ProMIS team in moving this initiative forward. So for the purpose of today's presentation, I've structured my slides along two main sections. At the beginning, I would like to give you a few words about the rationale and the ambition of the Knowledge Hub. So why is it that we are actually developing this initiative within the THCS project? And then in the second part of the meeting, I'll give you basically overview of how the hub is currently structured, what are the current functionalities, and at the end, I would like to conclude with highlights of some kind of like opportunities for engagement and where we would like to see your inputs and your engagement moving forward. So starting with the rationale and ambition of the Knowledge Hub. So as it was mentioned at the beginning, the Transforming Health and Social Care System Partnership is a huge European initiative, which is pretty much working across the different actors, countries and regions in Europe towards transformation and implementation of change so that we can achieve more people-centered, sustainable, more efficient health and social care system. And in THCS, we are running a number of activities how we are trying to support this implementation on the ground. First of all, we are trying to assess or kind of like map what is the current good practices, what is the current evidence saying about the transformation and changes in the health and social care system, what we can learn from these initiatives, what work well, what in contrast doesn't work well. And more importantly, based on this mapping, we also want to understand what is currently missing, what evidence we need to generate. So that's where a partnership is investing a lot of money in the new research and innovation projects. The second big part of the partnership work is around supporting the implementation and transferability of all of this research learning so that we really make sure that this learning transfer on the ground, transfer into the policy making, and also transferring to the new knowledge and skills which are necessary to implement these learnings. So that's where why we invest a lot of our efforts in the capacity building, evidence and activities to support, to bridge the evidence of from this research to policy. And the Knowledge Hub has been developed with the view to support these activities. So with the Hub, we want to provide the access to this evidence, which already exists, and we want to dwell into the details of this evidence, but we also want to promote the newly generated evidence. As I was saying before, this might coming from the new funded projects, either within the THCS, but also other European initiatives. And then with the Hub, we also want to provide you the access to the new tools and methodologies, how to support the implementation and transferability. And then, as I was saying, a big part of our activities is around the capacity building, and the Knowledge Hub really has this strong ambition to facilitate all of this capacity building and transferability of learning into the reality. So if you look at our kind of like overarching ambition when we were kind of like starting this proposal, you can see that all of these activities conducted in the THCS projects are very much reflected in the ambition of the Hub. So we are aiming to co-design and implement the Knowledge Hub as a platform which would facilitate capacity building, foster exchange of good practices, knowledge, but also be a platform which allows interactions and collaboration across different actors working at different levels of health and social care system transformation. So that's how we've kind of like built our vision, and we have then tried to bring this vision into some operational objectives, what we want to achieve with this hub, and pretty much just defining what we want to offer to potential users of the hub. So if you look at our objectives, I would like to highlight the 5 key objectives, and there's obviously a lot of kind of like spin-off sub-objectives out of that, but as I mentioned recently, it's really important for us that we connect the right people together. So in first instance, we are targeting to connect researchers, policymakers, funders, practitioners, and other potentially interested stakeholders to really work together to share their work, make their expertise available to other interested in particular practices or in particular knowledge. So give them a bit of platform or space where they can easily interconnect with each other and facilitate this knowledge sharing between these key targeted groups. Then, as I was saying, in the THCS, we are really focusing a lot on generating a new evidence, assessing and mapping the existing evidence. And we want to make sure that this evidence is visible as much as possible. So we want to maximize on these learning opportunities by promoting the knowledge sharing and mutual learning about these practices. Obviously, the hub with their promotional activities help or has the ambition to increase visibility of these projects and expertise and good practices. So our ambition is to make the outcomes of this make the outcomes of these activities very much easily to access in easy to read format, really having something kind of like tangible, easy to use, user-friendly formats. I mentioned the idea of connecting people, which obviously then means the support for cross-sectoral collaboration, but also collaborations with other regions and countries, not only in Europe, but also beyond, as we have a number of partners that are coming from, outside of Europe. And our ultimate objective is to really enhance the impact or the uptake of the research and innovation fundings into the real life settings to support the transformation and implementation of the change on the ground. And we have tried to reflect these objectives in the structure and the functionalities that we are currently offering. So we will shortly move to the section where I will explain to you how it works in detail. But before doing that, I would like to spend just a few moments to kind of like explain what you as the potential users can get from the hub. So as I was saying, we initially are targeting policymakers, practitioners, funders, and researchers, but I would say that other type of stakeholders would also find the value of using of the hub. And as you can see, I won't read through all of the slides, but we have tried to highlight what are the key kind of like selling points or added value for these different groups to use the hub. So for instance, if you look at the policymakers I mentioned before, how important is to translate the outcomes to the really policy relevant evidence. So we have a dedicated work stream in the partnership, which is looking at different tools and methodologies, how to translate these research outcomes into some practical examples and practical tools for the policymakers. If you look at the researcher, obviously it's the access to evidence, it's the opportunity to connect with like-minded researchers, look for some common opportunities for collaboration, including funding opportunities, but also the hub can be a space for them where to increase the visibility of their research work and make sure that they maximize on this research and disseminate it further. So if you kind of like look across this slide with the different benefits, what I would like to conclude that for regardless of what kind of user you are, we are really trying to in the hub to promote the environment where the users can trust each other and where they can really develop a collaborative space for their engagement and for their exchange activities. When it comes to the development of the hub, I would like to mention some key generic principles. I will not drill down into any technical development, but I would like to emphasize some key points because they are very important to have in mind as we go through the slides and as we go through the structure and functionalities of the hub. So what I would like to really emphasize, and I would like you to keep in mind throughout this hour, is that the hub is really developed with the bottom-up approach. So we are putting the users of the hub or potential future user of the hub as a key for the development. So we are running a number of co-designing activities in the form of online surveys or online consultations, but also dedicated working meetings and workshops where we present some kind of like visions for the knowledge hub, but then we really validate these functionalities and the layout of the pages, the content of the pages with the users. So even though the hub is already live, as you will see, and it has the current and it is live in its current version, we are constantly improving the hub as we go, because we are, as a result of these co-designing exercises, we are trying to implement these changes as we go rather than kind of like waiting for the end product and then implement all of these changes. So we are really trying to bring the users on the journey with us, and we are trying to hear from them so that we really feel the co-ownership of the hub, but more importantly, we really want to design something that is kind of like meeting the needs of the users, because obviously that's one of the critical points from the sustainability point of view, that we need to design something which is tailored to the needs of its users. So this is why the platform operates on the module-based platform, which means that we keep, adding new functionalities. We can add new structures as we go, and we have obviously a number of iterations. So as I was saying, the development of the hub is ongoing process, and it's changing as we go. And so with the last point, obviously we want to bring the added value. We don't want to duplicate the platforms and the hubs and other kind of like online tools which already exist. We want to build on them. We want to add some new functionalities. And we also want to make sure that our users are aware of those other existing platforms. So we are not trying to compete with each other, but we just really try to navigate the users through this number of hubs, platforms, and other online tools. Okay, so without further ado, I'll go to the structure of the hub. So in this part of the section, in this part of the presentation, I will introduce you how we currently structure the hub. We'll shortly explain to you the individual sections of the hub, and then I will introduce you the individual functionalities for each of these sections. So as I said, the platform is live, so the hub is live. We have officially launched the hub last September in 2025. Since then, we have moved to the version 2. So that's basically, as I was saying, we are in the iterative process. So we are revealing new versions of the tool as we go. So currently we are on the version 2. And if you look at the structure, basically this is the home page for the user who is already registered and login, but it's pretty much similar home page for every case. You see that we have those 5 key components of the hub as it stands now. It's resources, capacity building, synergies, transfer and implementation, and community. And if you recall my initial slide when I explained how the hub fits into the rationale of the THCS project, you can see that it basically reflects our THCS approach. So it's about providing access to evidence, facilitating capacity building, maximizing what other projects are doing, and generating support for implementation, and this community as a space for collaboration, connections of different users of the hub. So I will briefly explain to you what we mean by, I was a bit ahead of myself, what we mean by each of these sections, and then I will dwell even more in details what you can do with each of these sections as a user. So for the resources, so I will repeat myself, it is about existing evidence and newly generated evidence, and it can have various forms. So these resources can be in the form of good practices, they can be journal articles, they can be presentations, they can be description of particular service in the healthcare system. It can be methodology, for instance, or policy strategy and other. And you will see when I will explain the functionality that we are using this categorization of resources as one of the filter for searching and sharing the resources. But this is just to give you the flavor of what we mean by resources. For capacity building, so pretty much here, the idea is that we try to make access to existing initiatives which help to build new skills, new knowledge, new capacities on transformation of health and social care system. And again, this can have various forms. It can be some very well-structured training programs. They can be some discussion groups, workshops, podcasts, webinars, study visits. And what is important to mention here is that pretty much for each of these sections, resources, capacity building, and synergies, we are not trying to promote only the access to what we do as a THCS project, but we are also inviting other initiatives, either funded or kind of like national, local existing initiatives to help us to populate these parts of the hub. So as I was saying, we really maximize on these opportunities for capacity building because there is so much going on besides on what we are offering in the THCS project. In the synergy section, so I mentioned earlier that we want to bring the added value, so we don't want to replicate, duplicate the efforts. We don't want to replicate what's already there. So here we are really trying to identify what are other partnerships at the European level, but also what are other projects either at the European, but also national, regional, local level that can help us to maximize what they do by offering the access to the outcomes of these projects to for the users of the hub, again being either THCS members but also a wider community. And here we also, in addition to the projects, we are also, as I was saying before, trying to map what are the other tools, platforms that kind of like support this whole idea of implementation, transferability, good practice, repositories to navigate the users across these different opportunities and make sure that, again, we maximize what these initiatives, synergist initiatives can offer to our users. For the transfer and implementation framework, this is actually something which has been incorporated just 2 weeks ago, so that's quite new. And this is part of the hub which has been purely developed by the THCS project. So we have a dedicated work stream which has developed already the THCS handbook for transferability and implementation of solutions. So we have a dedicated structure where the users can learn about this framework, but more importantly, as you will see in the next slides, is that we also want to give the potential users overview of the solutions which are already working very well in practice, so you can learn from these practices, and more importantly, you can connect with them, and also through the functionalities of tools, you can search for some kind of like dedicated tools that can help you to learn much more about these solutions, and more importantly, the tools that can help you to transfer potentially these solutions into your local settings. And the last part, which is pretty much currently being under the biggest development, it is there, but not with the all functionality that we have envisaged. It's this section on community. So as I was saying, this is the space where we envisage to have dedicated functionalities to help to connect the users of the hub, give them some space for interactions, for sharing their outcomes of their work, or to give the opportunity to the user to, for instance, post some requests, like for instance, if they are looking for some funding opportunities, or if they are looking for some inputs into the surveys, and all various kinds of activities. I will show you later on when we get to this page what specific requests and engagement activities you can do currently on this section. And pretty much as for the every of this kind of like online platform, we have also developed a set of frequently asked questions where each user can learn about registration, login process, but also learn on how you can contribute to the different sections on the hub. And lastly, in terms of the structure, obviously, we also have this contact us form, which we use not only to raise the question, but also to provide feedback. Because as I was saying, we are really keen to hear from our users how we can improve, what is missing, what has worked well, or on the other hand, what hasn't worked very well. So it's kind of like a form to give us a feedback as well. Okay, so this brings me to the functionalities of the hub and some examples of the content that you can already see. Still having in mind, as I was saying, that it is work in progress. So I will present to you today the functionalities which have been already implemented, but I will also give you a few hints on kind of like future developments. Before going into the functionalities, what I want to emphasize is that we do distinguish between the type of the users, what functions you can use, or what sections of the hub you can really access and have the full potential of the site. So we really encourage interested users to register, because only if you register, you will be able to share what you do. You would be able to share your resources. You would be able to share, for instance, your capacity building activities, or share information about other ongoing projects. And more importantly, the access to the community is fully restricted by the registration on the hub. That's why it's not even visible currently on the main page when you are not registered. Also, when you at the process of registration, what I would like to highlight is that obviously we are collecting some basic information about who you are, but more importantly, we are also asking about your professional background, and asking what is, and we also ask you to identify what are your special areas of interest. So there is a pre-populated list of topics. These are the topics that we deal with in the THCS partnership. And the reason why we are asking for this information is that, as you recall, I've mentioned the functionality of the hub, that we want to connect the users of the hub. So for that purpose, you really need to understand what is the profile of your people. So if you have some targeted messages, like for instance, you will be looking for inputs for ongoing consultation for policy strategy, you would be able to filter your user by, looking only for the professions related to policymakers, for instance. And the special interest area, this is basically what is currently not fully implemented, but we are almost there. The reason why we are choosing these topics is these areas of interest is that we try to personalize the content that you are looking for, and also the content you are potentially interested to share. So when you choose those areas of interest, every time you log in to the hub, and obviously once you do a bit of search and a bit of kind of like work on the hub, under the notifications page, which is currently on the testing page, so I can't show you, you will see only the content which is dedicated to your areas of interest. So if you have something related to digital healthcare and special areas of interest, the hub would prioritize for you which content to look at. And also you can see, which is currently visible already, the content that you've populated, which is also important because, for instance, if you are owner of particular good practice or a particular project, there are some changes in the projects in terms of the outcomes, impact, and so on, and you want to add or update the resource that you have already generated, so then you can easily edit yourself rather than going through the administrators of the hub. So this is really just kind of like trying to make sure that you have your own working space on the hub, which is visible just for you. Okay, going to the functionalities of the hub, I would say that currently the functionalities are really reflecting those key objectives, as I was saying: access, connections, collaborations, and promotion. So in terms of the access, obviously, it's access to evidence, which, as I was saying at the beginning, it can have various categories and format. So when you go on the resources page of the hub, there is a set of filters that can help you to navigate through resources which are currently uploaded. So we have filters such as category, so you can see if it's a case study, good practice, methodology, policy strategy, also, as I was saying, service descriptions and others. You may have preference for a particular format, if it's a report, recording, PowerPoint, website, and so on. And here are the areas of interest which I've mentioned in the profile. So we have just introduced this as a filter as well. And this is basically to achieve that personalization and notifications that would get through directly to your profile. But yeah, this is currently being tested, but we are already implementing some of the functionalities. And obviously the keywords. So after implementing whatever filter, you will have this kind of like very short descriptions of the resources, pretty much just with the title, with a bit of images. But as you can see, there are also these little hearts and view details part. So obviously by clicking on view details, that's where you'll get pretty much much more information about this resource, but more importantly, where you can download that resource, or there is a link directly to the website and so on. And those little hearts, basically this is the way how you make the content that is kind of like relevant for you being selected. So if you go then on the home page, every time you log into the hub, there is also this little heart on the top, and that's basically your favorite content. And here you will have basically short descriptions of every resource or capacity building you choose, so that you can, you don't have to search for them again. If you forget something, you can quickly go back and see what's, what is available in your favorite content. Sharing of resources, that's only for the registered user, as I was saying. So everyone who is interested to share what they've done, there is a simple functionality to share. And we have these very basic four steps a form about the resource, capturing the information, really basic, the category format, pretty much reflecting what we have in the filters, short descriptions, a bit of visualization of this resource. Similar functionality for the capacity building, just filters slightly differ, but it's pretty much the same principle. You can filter, you can search by particular filters, but as you can see in this case, we also have this shared calendar, so we can also search the events by clicking on the particular date. And the same as in case of resources, you can choose that some of, like for instance, you are interested in the conference or event, you can mark it as your prioritized one, your favorite one, and you can see view details in this format. As I was saying, you have the link for more information, or there is a registration link, keywords, and other things. And it is just the visualization of the calendar. So when you click on a particular date, and if there is an activity which is happening, you'll get very quick overview what it is about. And by clicking on that, you will obviously see the full content, what's, how to register, how to participate, and so on. And similarly, as in case of resources, you can share the activity. So every registered user can use this calendar to promote their own activity. Synergies section, similarly, you can search by particular filters, and you have also very simple form to share this synergy. This is just showing you how we display these synergies. Currently, there's still some work on how to improve. But before I'll go to the implementation bits and community, I would like to mention, because for the section on resources, capacity building, and synergies, as I was saying, registered user can share, can upload what they find relevant, but there is a validation process behind it. So every resource that is, put under the, put forward as the uploaded resource will come to the administrator of the platform, which is currently our team, and we have this opportunity to view what this resource is about. We can amend ourselves if something is missing, but if, for instance, we are missing the information from person who uploaded the information, we can contact them to fill the gaps, and then after the approval, we will make the resource available. So currently it's a bit manual, but we are looking for some tools that can be incorporated into the hub to help us with this validation process to make it much more sustainable and more effective. So this is just a starting point for the validation, but we found it important to really have at least something in place. Okay, so moving on to the implementation framework and transferability framework. So as I was saying, this was developed in the THCS project. So we are really offering this functionality only to the registered user now. This section have three functionalities. So the first one is the handbook itself. So this is where you can learn about this transferability framework. And then we have solutions and tools, and I will quickly explain to you what each part has. So this is the page on the handbook. So through this very kind of like easy to navigate menu, you can learn about the handbook. So it has the section like what we mean by transferability, what it is all about, but also what are the current methodology for transformation and implementation, then the details of the transferability process and others. Obviously, this is just the screenshot, so I can't scroll down, but this is pretty much operationalizing the handbook, which is kind of like a written document. I think what is more interesting is this solutions and tools part. So in the solutions, pretty much the hub offers you the opportunity to to search for the solutions which we have already identified as the working solutions, or the other users have shared them as working solutions. Obviously, they have been validated the same way as resources and capacity building. And you can search for these solutions by different categories. So it's a target group, if you are policymaker, practitioners, funders, as I was saying, those different types of the users. Healthcare domain, if it's about the quality management, if it's about strategy, if it's about service redesign. So all these kind of filters help you to then find the details of that solution. So after the filters, you'll be guided to details of that solution. And then, as I was saying, equally as for the other functionalities, you can also create your solution. So if you have a good practice that is really working well in your region, in your organization, and you want to promote it, there is a dedicated field for a description of this solution. Again, I would like to emphasize that this will be closed only to the users of the hub at this stage. And the last bit of the implementation framework is about tools. So this is basically the outcomes of the mapping exercise that is ongoing in the THCS, where we are trying to map the different tools and approaches supporting the transferability of good practices. Again, through different filters, you can get the access to these tools. And I'm getting to the last bit of the hub in terms of the functionality. So I mentioned community building and the fact that it's really under the big development currently. This is what you can see right now on the community page. So as I was saying, we aim to build the place for collaboration, connections. So currently, all the users can contact each other through the dedicated create post form or publish a post form where you can put different requests. You can choose, as a title, if you're looking for funding opportunity or you have funding opportunities to share it, or you are looking for inputs to survey, consultations, and so on and so on. And as you can see, you are structuring this post along those areas of interest, which I've mentioned that you are meant to choose at the point of registration and profile setting, so that messages from this community are really tailored to your needs. And here are the examples of the current posts as they are. So you are able to search by these key areas: digital healthcare, research funding, for instance, or healthcare financing. And you can respond to the particular post. You can keep them as a favorite, the same principle as before. However, what we are kind of developing right now as the testing side is that each of these areas of interest will have a dedicated page where, which will bring together members who choose to join particular community and choose to join discussions, share the posts across particular topics. So this is just the example from other projects we are involved, but this is just to give you the idea where we are heading, that there will be this, as I was saying, a dedicated page for each of these areas of interest to give the members of the community opportunity to share some basic information, what they do, promote some events, announcements, share the documentation, good practices, and so on. So this is currently not visible on the live page. And the last development that is happening in the background is that I've mentioned that policymakers are also one of our targeted groups. So again, similarly to the transferability framework, we have a dedicated work stream in the THCS that is looking at different tools and methodologies, how to bring the outcomes of the research into the policy and inform the evidence policymaking. So they are basically developing this policy toolbox, which is meant to kind of promote all these tools that we have developed and make that kind of interaction between policymakers to be able to access the information in really much easier format and in the format that would help to inform their decision-making processes. So as I said, this is also in the development yet, so you will not see that on the hub yet. And I will conclude with the slide on opportunities for engagement. So at the beginning of my presentation, I've mentioned the co-design as the main principle for the development. And I would really like to emphasize the fact that, as I said, the hub is live, but it's a constant improvement. And we would be really keen to hear from everyone who is register on the hub or will be registered on the hub, and you will start using these functionalities to really let us know what works well for you, what doesn't, or what you are still missing, because obviously there is a bit of vision from our side, but we really need to learn from those who are potentially using these tools on day-to-day basis. So we need to understand those kind of like missing gaps. And we would also like to invite everyone to help us populate the hub further. Obviously, there are already some resources, there are already some activities, but we would like to enrich the content on the hub. So please do use those functionalities on sharing. Please have in mind Knowledge Hub as a place where you can promote your activities and where you can engage much wider audience, and very often different audience that you maybe are exposed to. And also, maybe the last one that I will conclude with is we really would like to hear your inputs on the knowledge and transferability framework. There is an open call for the testing of this functionality. So in case you are interested to hear more about the handbook, how it can be used in your day-to-day practice and how you can potentially test the whole process, we would be very happy if you can, if you get in touch with us. And that should be me. Great. Thank you very much for your attention, and happy to take any questions. So I'll just stop sharing so that... Okay.
Grazie mille Andrea per questa presentazione che ci è stata utilissima. Chiaramente adesso è lo spazio adatto per tutte le vostre domande. Vi invitiamo a utilizzare la chat di Webex per porci tutte le domande a cui avete bisogno di una risposta. Nel frattempo io vi ricordo che questo webinar è stato registrato perché è andato anche nella diretta streaming del canale YouTube del ProMIS, quindi rimarrà disponibile per essere visto anche in un secondo momento, e potrete quindi ricorrere tutte le volte che ne avrete bisogno a questi contenuti. Non ci sono domande, il che credo che sia un'ottima notizia, perché significa che Andrea ci ha spiegato tutto nel dettaglio in maniera molto chiara, e infatti ci sono già dei ringraziamenti da parte dei partecipanti per l'intervento di Andrea. Quindi se non abbiamo ulteriori domande, io vi ringrazio moltissimo per la partecipazione, ringrazio ancora le relatrici. Assolutamente sì, rispondo io, sarà possibile avere le slide. Abbiamo preparato una pagina dell'evento sul sito di ProMIS, promissalute.it, nella sezione eventi ci sarà una pagina dedicata a questo evento, nella quale ci saranno anche le slide, che comunque invieremo a tutti coloro che si sono iscritti attraverso il form. Vi ringraziamo ancora moltissimo, ringraziamo le relatrici Andrea Pavlikova e Elisa Leonardini, e speriamo di rivederci presto per altri webinar e altre iniziative. Grazie.
Thank you very much.
Thank you, Andrea.
Thank you, bye.
Thank you, bye-bye.